And welcome back to Atlanta and Company. I am Rashawn Ali in for Christine Pilara. When you often think of Botox, you think of smoothing out the wrinkles on the face, but most recently, doctors have been using it as a treatment for migraine headaches in adults. Dr. Mishu of Midtown Neurology is here to explain how it works and how he can help you. Good morning. How are you, doctor?
I'm fine, thanks. How are you?
Okay, now before we get into Botox, explain what a neurologist is and why we are here talking about migraines and headaches.
Well, a neurologist is a specialist that deals with various neurological conditions in the brain, for instance, with stroke, seizures, and Alzheimer's, in the spine for neck and back disorders like pinched nerve syndromes, which we do a lot of, non-surgical management, and even in the extremities as the nerves and the muscles like a neuropathy or carpal tunnel syndrome. But migraine headaches and headaches in general are so frequent that made me want to come on and talk about how frequent migraines are. Did you know that 30 million people in the United States actually suffer from headaches or migraines? And migraines and headaches are the #1 diagnosis that causes the most loss of productivity in the United States. You know, if you have a bad headache or a migraine, you can't get into work sometimes. Or if you start getting a headache when you're at work, you may leave. Or if you can't leave because you don't have time off, think about how much work is lost if you can't even work at all because you're too focused on having a headache. So that's why I thought it was important to bring this up today.
Now, are there different types of headaches? Because sometimes you can feel a headache here, it's like here. Tell us about the different types of headaches and what do you think people should be concerned about?
Well, there are obviously various different kinds of headaches. The simple headaches that you may have from time to time where you just take any over-the-counter regimen that may make it go away, to the full-blown migraine where you're stuck, you know, in bed under the covers. And, you know, headaches are not normal. I mean, if you are finding yourself having headaches for more than once a week or several times a month, or find yourself in bed all day long, sick, throwing up with a migraine, that's not normal and you should seek medical attention.
Okay.
If you have yourself taking too many medications, daily medications for headaches, that's not normal as well. Or even if you have a neurological symptom that's associated with a headache, such as a visual phenomena or flashing lights, loss of vision, even tingling, numbness, or weakness in an arm or a leg, that could be the sign of a neurological complication or what we call a complicated migraine, which should also seek medical attention to see your doctor for.
Now, you mentioned that you can obviously get something over the counter for headaches, but what else can be done for headaches and what kind of medical treatment is out there?
If you have the occasional type of headache, any of the over-the-counter regimens can work. But if you find yourself having more frequent headaches, that's when we start talking about management of headache and migraine. The medicines that one takes that either you get over the counter or medicines that your doctor may give you, that's what we call abortive control. You take a medication, it kills the headache, you move on. But if you're having headaches frequently, almost daily or several times a week or several times a month, then we might want to shift into the preventive management of headaches. And there are various different medications that one can take, not for long hopefully, but you take on a daily basis that can actually prevent the headaches from coming on.
Okay.
And you take them and it kind of resets the receptors in your head, and then it keeps the headaches from coming. You can manage them more appropriately.
Okay.
And then of course you might want to look at the triggers. Various people have different triggers for headache and migraine. The most common, of course, stress, and in a bad economy, stress is the most common trigger, but also lack of sleep and various foods like wine, cheese, chocolates, the good stuff.
Right.
And if you do your job correctly as a physician, you can allow your patients to have some of those food triggers without it triggering a migraine.
Okay, now we got to talk about the good stuff. Botox.
Yes.
How has that become therapeutic for migraines?
Well, as you know, Botox has been approved for many years for, at first, neuromuscular conditions and then for the cosmetic industry. And what happened was, when people were getting Botox injections for cosmetic purposes, they were telling their doctors, hey, I'm not having as many headaches as I used to. So that led the company that makes Botox, Allergan, to run a few studies to see if there are injections that one can give in a certain area of the brain or on the head to where you can actually prevent headaches from coming. And in fact, in October of 2010, the FDA approved Botox for the use and management of migraine.
Wow.
And it's given every 3 months. They're very localized injections.
Okay.
It does not hurt, and there's no downtime at all associated with this, and it's well tolerated.
So every 3 months, somebody would go back in and get another injection, and does it kind of depend on where it will go on the head, or?
Well, there's an approved injection procedure and paradigm that's used for this, and in fact, the injections are very easy. It takes 20 minutes to inject. It's much like we do in the cosmetic industry. You give some here, the frown lines, you give some here in the forehead, and then you have some injections on the temples, where a lot of people get their headaches, and then a few on the back of the head and on the neck.
Oh, wow. So but how safe is it? Because if someone hears of this, they're like, I'm never getting Botox for headaches.
Well, it's actually very safe. Botox is not absorbed through the system. It's given localized as far as small injections under the skin. There's really, if you do the job right, you don't see any evidence that you've had the injections. There might be a little soreness in the back of the head the first time you get the injection. Of course, there's a nice side effect in that you get better looking skin and fewer wrinkles, especially here and on the forehead. Some people want to come and get it here later because they like the effects. But we have been injecting Botox now since October, since the FDA has approved it. And the studies that actually got Botox approved for injection showed that about 60% of people saw a greater than 50% reduction in their headache and migraine. Our studies that we ran personally, our success rate is 85% of people.
That's awesome.
Who have very little to no headache and good control of their headaches and migraines.
Okay. Now, does insurance cover Botox?
Yes, it does.
Really?
Yes, it does. Actually, insurance, all insurance companies have been approving it. You have to meet certain requirements. For instance, you have to have had more than 14 headaches per month, lasting more than 4 hours at a time. You've had to have headaches and migraines for over 6 months. You've had to tried and failed 2 different preventative medications out there, and then they will approve it. And in fact, that seems like a lot.
It does.
But you would be surprised at how many people meet that criteria, which I think is more important for people to understand, that don't wait until they become daily headaches. I mean, headaches aren't normal. Again, I don't suffer from headaches. I know a lot of people who don't. But it's impressive how many people out there will wait till they get that bad before they seek treatment.
Okay. It sounds very interesting, and thank you so much for joining us. You were great.
Thank you.
All right. If you would like more information about Midtown Neurology, you can give them a call at 404-653-0039 or visit them online at midtownneurology.com.